An overview of what's happening in Canada right now. So the Canada Prenatal Nutrition Program, our CPNP, funds over 236 different projects. And they specifically look at pregnant women and new mothers with the risk due to poverty, teen pregnancy, and different issues. And these programs usually include counseling, nutrition support, and education, nutrition vouchers, supplements, and so on. And these are wonderful. I think they're targeting, these higher risk groups, which is what is the need. But because participants can only usually participate if they report their income or they report a level of food insecurity, I do feel like it's limiting a lot of the population to actually receive this education. And unfortunately, at least in my experience and experience of peers and colleagues, there's little to no nutrition education typically during medical appointments during pregnancy in Canada. It's not really discussed in great detail unless you're diagnosed with gestational diabetes. That's usually the only time that you'll actually get to see a dietitian and talk about these needs. So again, I think promoting education and health professionals so they can relay this to their patients and clients and in their communities is so important. And then again, I think we have a great breastfeeding support in Canada, particularly at local health units. And then we also have Ontario Human Rights for breastfeeding and pregnancy that I think are important for all women to be aware of, that you do have rights and you have these rights and these relate into your workplace, into your community, and so on. And then one last thing I wanted to kind of talk about that I just think is important when we talk about equity as a whole in maternal nutrition is that when we had the change to the child benefit in 2016, we actually saw significant decreases in food insecurity amongst young children across Canada. So this goes back to when I said it's not just the individual mother's choice. Sometimes it's what they have access to, it's their means. And when we address it at that policy level by increasing that financial support for young mothers, we see child poverty actually reducing from 2019 to 2020. It went from 9.4 to 4.7. That's a huge jump in 1 year. And we saw with the introduction of that child care benefit, or the Canada Child Benefit, that it was associated with a 1 to 4.7 lower probability of severe food insecurity among all families in Canada, which again, is incredible to see. Even if it's a small percentage, that still makes a huge impact on if it's the entire population. So again, I want to just kind of bring light to that these larger policy ways of addressing these social determinants of health, like income, can make huge impacts on the health of women, pregnant, non-pregnant, and young children. So I want to thank you all so much for listening to this presentation. I hope you found it informative, useful, and you can apply this into your own life, practice, family, friends, whatever is relevant to you. If you have any questions after the presentation or you want to contact me, my email is on the screen. Thank you all.
Foremost, we can see that's the diagram of the gender result framework. The diagram is looking at economic participation and prosperity, which also relates to women participation either in the workforce or in leadership position. Then poverty reduction, health and well-being, access to health care, food security, then gender-based violence and access to justice. Another key area of the framework is the gender equality around the world. Then education and skills development. Education is a very crucial social determinant of health that can influence other social determinants of health. Education is information, and education is empowering, and education can help the women or those creating this program to make a cohesive and a very comprehensive interventions. So that's where we'll be looking at. Then there's a diagram of the 10 essential public health services. And next is the intervention format. So this intervention format on the screen is a suggested evidence-based intervention format that encompasses public health foundational standards and sciences and overrides multiple models and frameworks. This particular format also underscores pertinent innovation and technology-based strategies and emphasizes contextual Canadian GROF in the development of GRF areas in the development of female gender equity focused interventions. Importantly, this format incorporates a prospective evaluation guide to assess these interventions' success chances and sustainability. Performing better. A higher proportion of males than female reported waiting 3 days or less to see their regular health care provider. And this was consistent across all age categories except 50 to 64. It means male had to wait more to access healthcare than women. Women accessed healthcare more than their male counterparts. Then the other one is access to healthcare. There are different wait times that we are used. Access to primary healthcare provider, then hospital stay. Hospital stay extended until home care services or support ready for female was higher than men. So this category, the women are not still performing as good as their male counterparts. So three women, for every 5 patients, 3 were women who had to stay longer in the hospital because home care services were not ready. Then another social determinant of health is education. Process. Then we are gradually rounding up the presentation. So what are the intervention success chances and sustainability? Check for studies that shows the intervention success chances, either at the national level or at the provincial level. There are interventions that are already outdated. Probably they've already achieved what they should. The goals of that particular intervention. Such interventions can be rolled away and replaced with newer ones that address existing problems. Okay, we should indicate the female population estimate reflected in such studies. We are looking at developing an intervention. Assess for these factors: volume of work and time commitment to intervention, the men, the material, the method, and the money. Gauge the intervention success chances and sustainability based on these factors. You could use these 2 tools. They are in Appendix 9, which is the success chances evaluation checklist.
I guess to start, my name is Chantal. I'm a resident physician at the University of Ottawa. I'm in the public health and preventive medicine program there, and I'm in the family medicine stream. So I'll be finishing my family medicine program or credentials in the next 6 months, fingers crossed. So, but my passion is public health and being able to work in that area, in particular, an interest and focus in youth mental health, substance use, and especially as it affects racialized communities. And I identify as a Black woman, and so that's a community that I think I have more experience working with in terms of mental health and substance use. But in general, I think it's something that's near and dear to my heart. So I had to make it a bit more general in this context so that it would apply to Canadian women. But I did review some of the basic Statistics Canada data and I think the biggest thing, the most helpful thing is perhaps the insights around what this looks like clinically and what programs exist to address these issues. So I'm not an epidemiologist, at least not yet, so that's not my expertise, but I'll present that data and then provide a bit of context based on my experience. So yeah, as mentioned, I'll identify some of the key patterns, but really the hope is that we can go through some frameworks of that work with some of these programs and the specific programs that I found to be helpful, both in referring patients to, but even being a part of them and learning about the work that they do myself. So starting with substance use, when we look at some of those patterns, cannabis is the one that I'd start with because it's the most commonly used substance by women in Canada. And that has increased quite significantly post-legalization, which was in 2018. And when you compare the rates prior to legalization, it was about 11% compared to 19%. So it's quite a significant increase, but it, has leveled out, and I'm curious to see what that data looks like when we have more available in the coming years. But we do see that it's uptrending. And when you look at the graph that's on the right side, we do see the specific population that is most likely to use, and that use is increasing in 20 to 24-year-olds, which makes sense. Those tend to be college age, university age working youth that are transitioning to being legal age to consume, but also have access to it, have access to funds. So all those are factors that increase their use and the likelihood of use. The other thing, I do recognize that when they ask the questions in the survey, they ask if you've used within the past year. So with something like cannabis, it's within the past year. And so there are youth that may not actually be using frequently or have cannabis use disorder, which means have a dependence on cannabis, have symptoms of withdrawal when they stop trying to take cannabis, and have a functional impairment to their lives. So there's a lot of you who don't have an actual cannabis use disorder, but they do use, and the frequency of that use has the ability to impact their development. Some other factors to consider in terms of patterns of use amongst women include youth, as mentioned, lower income, concurrent anxiety or mood disorders. And I've seen this in clinic that people who have anxiety, they actually try to calm that anxiety with cannabis. And so they'll try and smoke cannabis to relieve those symptoms, or they'll drink alcohol as a depressant to try and treat their symptoms. And it's interesting and challenging because part of it has to do with access to care and lack of access to care. And so people try to self-medicate or self-soothe with cannabis. And I see this very frequently. And the last risk factor is first trying cannabis at or younger than 15 years old. And so when people start consuming in what would be a middle school or early high school, one, not only is their development, also when you think about the adolescent brain, their brain is different than the adult brain. The way they make decisions and how they spontaneously make those decisions looks a lot different from adults. So if you're accessing a substance that makes you feel good, and there is a less of an ability, saw that was actually done, compared rates between 2010 and 2021 of substance use in women pre-incarceration. So these are women who across Canada, prior to them they were already charged, they're about to be imprisoned, unfortunately, but just prior to that, what was their use? And they were asked about their use of substances. And in that population, they divided it based on province, and then they had Canada-wide. And alcohol was the most commonly reported substance, just like the rest of, different from the rest of Canada, less cannabis use, surprisingly, than alcohol. And then opioids, so 12% compared to 1% of women otherwise in the country, are the most commonly used substances. And when they asked about severe substance use challenges, so once again, that connects back to dependence, withdrawal, functional impairment, that 40.8% of women in that study, and there are about 3,400, had severe substance use challenges. And a substantial portion, 23.7%, had a prior history of injection drug use. So you see that like a large proportion of women who are using IV drugs that are in these precarious and very, I think, disenfranchised or marginalized situations that can lead to making it hard to fully understand what the rates are of use, but also make it hard to intervene, because being in prison is not the end, are also struggling to access external supports, in part because often these are conditions that affect your function. And as a result, people lose their jobs and their homes, and they lose connection to family and to friends. And this can perpetuate use and also symptomatology from mental health conditions. So these types of wraparound services are so critical to the care and the recovery, even for people who are experiencing mental health and substance use. And recent announcements from the government to shut down, I think 10 of the 17 safe conception sites that are approved in the province is, I think, ridiculous, and needs to be addressed from an advocacy perspective, because these are sites that are literally saving people's lives. So key takeaways are the rates of mood and anxiety disorders are increasing in Canadian women, and access